Yeah, so we're here to create that awareness and just tell people where to start and how to just go and seek for help.
Hello and welcome back to another episode of HBG Engage. Today we have Kaday Kamara. How are you today?
Hello, I'm good, thank you. How are you?
I'm very, very well. Thank you very much for sitting down with us today.
Thank you, no worries.
So you are a registered nurse,
Yep.
mental health clinician, and a mental health advocate.
Yep.
But first of all, can we just go back to the start and find out about yourself, and I guess why you decided to become a nurse, and also knowing you, I know you weren't born here, you came here with your family, so just give us a bit of an insight about that as well.
Well, my name is Kaday Kamara. I mean, people call me Kaday, same thing. 25 years old. So, to be honest, going back with mental health, I never knew what mental health was. Like, when I came here, because the family I'm from, like, they don't even talk about mental health. You don't talk about your emotions. You basically just wake up and go with your day. So growing up, that's what I saw. And coming to Australia, I moved at a very young age. So when I moved out, I was just like, my head was just down, working my way up just to, look after myself and everything. I never spoke about mental health. Then I was like, what's the next thing I can do to make my life better? What's the next thing I can do to make my life better, So I wanted to do modeling. I played soccer growing up, so I never thought about nursing. I was like, there's no way. If someone says, can you be a nurse? You'll be good at it because you're good with people. I'll be like, nah, no way. That's yuck. Why would I do nursing?
Yeah.
And then when I moved out, I had nothing else. So I had to look for something quick to just go to work and just make money so I can look after myself, because I was living by myself at that time. I picked nursing. When I was going through my nursing journey, I really didn't like it because nursing is so broad. There's so many different areas of nursing. And then I got to the mental health unit, a unit, and I'm like, oh my God, this is so good.
Yeah.
What's this? Because before that, I never knew about
really
mental
had
health.
an idea about what was going on. Yeah.
And then I really enjoyed that unit, the mental health unit. Then I was like, okay. So after my nursing degree, I decided to just I need to learn more about this. So I pursued mental health nursing.
Yeah.
So after my degree, I basically went straight to do my new grad, which is another 1 year. So for my new grad, I had half medical and then half nursing. So I'm half medical, half mental health. So then I picked all mental health because I was so interested in it.
Yeah.
And then here we are. And the more I learned about mental health, the more I kind of felt like this is what I love. I enjoy talking. I enjoy just actively listening. I enjoy working with people by just healing them from within. So I like the idea of healing people from within, and so they can blossom on the outside. I really like that, and that's why I kind of pursued mental health.
Amazing. And then how many years did you study to become a registered nurse?
So registered nurse, I studied for 3 years.
3 years.
So that's a combination.
And then after the 3 years, you then decided to pursue the mental health.
Mental health. So that's
aspect.
I did another year of new grad, just all mental health based. So I did all mental health 1 more year, and I decided to just stay in that and just do mental health.
Amazing. And you've been enjoying it so far?
I've been enjoying it. I've been it's just such a rewarding job, every day I go to work very excited to be there, because I just think about how I'm like, oh my God, when I was younger, I didn't know about what this was, and now I am here changing lives. I get in the office excited to be there,
That's good.
Yeah, I'm just.
So in terms of your role at the moment, are you working within a hospital space in the mental health unit, or are you working, I guess, in an office kind of environment, or is it a mixture of both?
Okay, so it's a mixture of both. So with my experience, when I started mental health nursing, I've done community nursing, which is in the mental health community. I sat in the office 5 to 9 job, basically 9 to 5 job, basically interviewing people, doing triaging, just doing a whole assessment. That's I did that for a while. It was okay, but I didn't like the hours.
Yeah.
Then I went into inpatient, which is like mental inpatient, acute area, very busy, very unwell people. I did that as well for a while. I was like, yeah, that's all right. And now I work in the emergency department, which is like mental emergency, but
Okay.
it's a combination of everything. So I do a lot of in-charge roles. So as an in-charge, I basically go out when a patient presents with mental health issues. So they call me to come in and see the patients. I assess them like in the triage area. Then
Yeah.
I get to decide if this patient is for drug and alcohol, mental health, or if they need to go to a medical bed first before coming to us. Yeah, so that's what I've been doing. And I enjoy the emergency department because you see a lot of like different scenarios. Like
For sure.
every day is different. And it's just sometimes it just because you work in the area, you don't even notice it.
Yeah, for sure. And imagine if someone was to come in for the first time, they would think there's a lot going on here, but you kind of maybe go into autopilot and you're just getting things done.
The things that I like we deal with every day, with like especially some of the things like young people coming in, like suicidal. I'm suicidal. I want to end it. So when I first started, I used to go through vicarious trauma, which is basically when a young person comes in and tell me, oh, I want to end my life. I kind of reflect on, oh my God, like I went through a very horrible stage in my life when I moved out. Like in my culture, like as a young girl moving out at a young age, you're not allowed to. So when I moved out, my family kind of kicked me to the side.
Yeah.
So I have to go out there, find my own way for a long time, because I was like, when I see young people coming in and they've lost everything and they're like, oh my God, like I want to end
what do I
it.
do next? Yeah.
I kind of felt like I used to have vicarious trauma. I was like, oh my God, like how come I went through all this? I started reflecting on my story and what happened to me. But now it's like going through that and going past that stage, that vicarious trauma has now switched to me saying, look, no one was there to kind of help me through this because I didn't know about mental health at that time. But now I have this chance to just help these young people and make a difference and just be like, look, yes, you want to end it now, but look ahead of you. You have so much ahead of you. Like, I try not to make it as a peer support work because I am a clinician and I have to set boundaries and like, everything we do is evidence-based. But as a peer worker, you get to be there and be like, I went through this, you can too. But then as a mental health clinician, like I have to be like, okay, how can I help you go through this? Which I put in my story in, with removing myself out of this. This is about you, And so it was incredible. I felt like...
And do you find now that you've stopped, I guess, vicariously associating with those kind of experiences with those kids, do you find you're able to do your job a lot better?
So much better. Yeah, it changed my life. Like, and it's just normal as a human being. Like, it felt like an exposure therapy for me. Because I was like, I didn't believe in mental health for a long time. I was just like, no way. Like, this didn't happen to me. Like, because when I was younger, I didn't know about it. I'm sure if I knew about it, I would have gone, asked for help, and then just be like, what
I think
can
a
I
lot
do
of
to
people
get
would
through
have.
this? 100%. And then I didn't know about it. And now we're just so grateful to have all this awareness, even though we need so much more work on this. We need so much more work to kill these stigmas. Like, there's a lot of stigmas out there. Like, people get up and go to a GP and say, can I please do my full blood counts? Can I check, like, just physical checkup every 3 months? I do mine every 6 months. Like, what's wrong with going in and just
having a mental
and be
health
like,
checkup?
Can I just... Because our mind goes through a lot of things, especially the generation we're living in right now. Everything is changing every day, and we have the time to check up our physical health. And the most important thing, your mental health, because everything connects. Like, if you're not checking your mental health, no matter how much you're doing physically to check that, like, it's not helping there.
100%.
Everything connects. And that's what I've noticed. I'm like, if I'm checking my physical health, it's the same thing as going on and being like, let me check what's going on mentally. And I think half of the reason why people don't do that is because they don't know how to seek for that help. They don't know where to start. They just don't know where to start. And
100%.
So we're here to create that awareness and just tell people where to start and how to just go and seek for help and I've got a lot of ways to
Exactly.
kind of like, you know, delve into that.
I want to just go back slightly, I guess, towards you deciding that you wanted to study within the mental health space.
Mm-hmm.
How was that process of, I guess, learning at a university level
Mm-hmm.
to combat that when you're going into actual the real professional world?
Well, when it comes to a mental health at university, it is scary. The stigma is real. When you're at university, what they teach you, you get scared to even get into mental health nursing because you're like, oh my God, there's no way. So the stigma starts from like what they even teaching you at school. There's already society and the stigma. So my first time I got into the mental health like unit, the ward, I was scared because I've built all these pictures in my head of how the patients will look like or how the patients will be. And one thing I've noticed about mental health patients, they know. If you're going in to talk to someone and you know yourself and you're not
They
like
can
being
tell.
genuine, they know. Of course, if someone hands over to you that this patient is this and that, and you go in with that approach, they know that you've already like put in a barrier before sitting there, you know. Like what I've learned through my nursing career and working in mental health is that I come in as who I am, you know, and I'm talking to the patient, not at the patient.
Yeah, for
Sometimes
sure.
people are like, do this, do that. I'm talking to them like, how can we do this together? You know, like I'm a human being, you're a human being. How can we work together, you know? And what I notice in the field is that people talk at the patients. And if they notice that you're talking at them, they don't want to get involved with
Exactly. It's going to be a lot harder to get through to them and help them in the long run.
help them. And
And what kind of challenges do you see, I guess, your patients face on the regular?
There's a lot of challenges that there's many, like one thing that stands up for me more is seeing young people coming in and they're suicidal, 17, 16 years old, coming in and they are suicidal, they want to end it. That's very challenging for me because first of all, I'm a young person myself, and every day I wake up, like every day. The reason why I wake up grateful every day, because I don't know if you know about this, but my background, I came to Australia as a refugee, and yeah, my country had war, so we moved here when I was 13 or 12 years old, and in that war, I was born during war, like gunshots and everything. Like I always think about how one thing I always hold on to. I'm like, why didn't I die during that war? You know, why am I still alive? So every time I think about that, nothing can stop me with everything I do. I always reflect on that. I'm like, there's a reason why I'm alive today.
Yeah.
So no matter how bad life is, I never look at my life like, that's it. I'm always like pushing myself through every obstacle. That's like,
Yeah,
I'm
you
like,
almost look at life slightly different because of where you've come from.
Exactly.
Yeah.
So it's like when I see that, I'm like, oh my God, that's that. And when young people come to me saying that they're suicidal, I'm looking at myself. I'm like, what is one thing that I can make these young people hold on to keep going, to keep pushing? Because I'm telling you, if it wasn't for that reason, every time I feel down and I feel like there's nothing else out there, I think about that one thing that gives me purpose to move forward. So every time a young person comes to me and say, I want to end it, I'm looking at it. It is broad. This is just based on my experience.
Yeah.
It is broad. I am a clinician. I work in the field, and I know how hard it is to just say you can do this, because sometimes people are like, you can do this, or people are going through worse. It's not the same.
It's not the same.
It's not. Everyone's situation and life
very, very
experience is
different.
very different. So it's like every day I'm learning, and I'm just like, what can I do to help these young people?
I've never really liked that saying that someone has it worse, so you're not allowed to feel
don't
bad,
like that.
because it's almost as if you're saying, if I'm happy now, you can't be happy because someone else out there has it better. You know what I mean? So
that annoys me.
yeah, so if someone is in a place where they are feeling down, and maybe in comparison to other people across the world, their situation from the outside looking in doesn't seem as bad, but for them right now in the space that they're in, they're not in a good place. So I think it's a way of downplaying people's emotions, which I think is a massive part of the problems, because a lot of the times people will not talk about their feelings because they think that they can't because someone else out there has it worse, or maybe one of their friends has it worse. But I don't think that's really fair to dismiss people's emotions on that level.
I feel like we all go through that. I went through that in my life, because I am a genuinely happy, bubbly, fun person, okay? And I want to go out and spread good energy and stuff.
Yeah.
But sometimes because, let's say, for example, COVID was so bad. I worked through the whole 3 years of COVID, okay? And when I go to work, everyone is stressed because of what's happening in COVID.
I can only imagine.
For me, for some reason, I was so grateful. I'm like, look, there are people that have lost jobs, people that are working from home, and I'm still here. I get to see people and help people.
Yeah.
That's what I hold on to, you know? And this whole thing about, like, why are you sad? Like, people are having the worst. People are having this and stuff. It all comes back to who you are as a person. Like, if I know myself, I'm still learning to get to know me, okay? It's very important to get to know you and learn how to just separate yourself from the whole world. Know you, and you go out there, you give your best self. What that does is that you don't really care what people think or what's happening in other people's lives, because you're out there with a good intention that I'm there as my full authentic self.
Exactly.
You know, but if you're worrying about what's happening around you, then that's when you
end up
start
losing yourself
second
slightly.
guessing everything. You know, like, if I feel sad, I feel sad. You know, whatever is making me feel sad, I should be sad. But I'm not. Why am I comparing my sadness to someone else's?
Someone else's, exactly.
You're doing that because you're not sure of who you are. And then why is it coming? Are you being, like, true to yourself? I'm entitled to tell people I am having a shit life.
Yeah.
I've got family back home that I have it worse, like, they have, you know, whatever. But then when I look at myself, if I'm sad, I'm sad. If I'm not having a good time, I'm not having a good time.
It's important to accept the emotions that you're going through.
100%.
Because they'll pass.
Yeah. And it's just like the comparing between, people have it worse than you. I really don't like. It's very bad.
Yeah.
It's okay to express how you feel. It's okay to just let it out. And the other thing is also, that's not acceptable for me. I don't like when people go to, like, friends for advice. You know, like, it's okay. It works for everyone differently. But your friends are not your therapist, okay?
Exactly.
Like, you go in and you're talking to your friend about, this is what happens to me today, this, that. They're not your therapist.
Yeah.
And secondly, it's like sometimes your friends are going through their own issues already, their own problem.
And sometimes their advice, even if it's coming from a good place, can be quite biased because they know you personally. So even if it's to do with a relationship situation, a lot of the times they're probably going to side with you, even if they don't think they are, but they'll have that bias because they'll feel a lot more loyal to you. And I think it's okay to go for advice, but I think there should be a cutoff in terms of what you seek it for, because there's certain conversations that should be done with a professional.
Yeah, what I see is that it's okay to, like, you find that one friend. Like, I tell everyone this, I'm like, in my life I've had like 5 adults, like 5 people that I look up to. Like, you need someone to tell you how it is.
Yeah.
You can't just have a friend that will always be like, yeah. You need someone that will be like, you know, that you look up to as a mentor. Like, I want to be that person. That's why you're, like, the people you look up to is very important. You need someone to have fun with, party with. You know, you need someone for everything. You can't just be going to everyone out there telling them your problem or what's going on. Because having that, everyone is giving you their own opinion and ideas. It's not good enough.
Yeah.
Some people like to get advice from their family members who they trust. That's okay. But you need to pick and choose the people you talk to. I'm not saying don't talk to someone, but pick the people you talk to. That's all right. If you don't want to go professional, that's okay. Pick the right people to talk to, because you don't want to be telling someone and they're giving you all this information to make you feel worse.
Exactly.
You know, and even if they're advising you, they're not fixing the problem. I tell my friends, I tell everyone, I'm not your therapist.
Yeah.
Because people be like, oh, you're a nurse. No. Once we have that relationship, I'm not your therapist. Because you're not just my patient, you're my friend, you're my family. So it's different.
Exactly.
You know, go seek professional help. I can't be part of that.
100%.
You know, so I'm already at work giving everything. When I'm out of work, I'm just want to turn up.
Exactly.
I don't have time for that. You know, don't talk to me about anything sad. Like, I would lead you to the right people to get help from, but just not me, you know. I need to look after me too,
Exactly. You don't want to burn out.
Exactly, yeah.
But leading on for there, we've slightly touched on I guess there's a stigma around mental health.
Mm-hmm.
Do you think the stigma around mental health is improving? Where do I start?
Kinda, you know what?
I think it is.
I am like, you know what? I'm actually, alright, I'm happy. Okay. We're getting somewhere.
Yeah.
We are getting somewhere, because I feel like everything will start from somewhere. With mental health stigma, we are getting somewhere, to be honest, because all this awareness, that's the good part about social media as well. There's goods and bads, but the good part is all this spreading awareness, all this and then I like when it's genuine as well, not just people putting it out there for the sake of it, but genuinely spreading that awareness. Because not just I don't have a therapist myself. That's naughty, but I don't have a therapist myself. But then it's like for me, I'm always in the field anyways. I need to get myself a therapist. But then I've trained myself to just know the things I do when I'm feeling low.
Yeah.
I've trained and it works for me. It works for me. So getting a therapist is like helping you, guiding you through these things. For me, from a young age, I've learned and taught myself how to do things that works for me to get myself better, But then that doesn't mean I shouldn't get a therapist. I'm still going to get a therapist myself, I'm doing my master's in psychotherapy and counseling. The first thing at the start of my master's, get a therapist.
Oh, they say that to you?
It is important.
Yeah.
Everyone needs to get a therapist in the course because you're dealing with people every day. The reason why I don't have a therapist, but I have mentors. I have great people that I click with, clinicians who are we don't work in the same place, but they're my colleagues.
Yeah.
We sit down, we have a chat about this, we debrief about things that happen. That's good for my mental health, But people, if you don't have that, it's very important to get a therapist. Have someone that you can speak to or talk to. Sometimes you don't even have to go through all the process. Sometimes you just need someone to just debrief with. Psychologists, they will sit there and listen to you.
Yeah.
And they have, if they need to do anything, they know, they're trained to do this, So the stigma is getting better. We still have long way to go. We still have long ways to go.
And what about, I guess, certain things that you do to help keep a positive mental health?
Oh my God, thank you. I like this. So to be honest, for me, everything comes back to mind, body, and soul. Okay, it's so what I feed my mind is important. Feeding my mind to reading a wellness book, listening to podcasts. You need to feed your mind the right things. It's very important. And if I'm going on to, especially social media, there's so many things TikTok and all these things. You need to know how. Sometimes I look at things, even though how people want you to choose one side. I'm not like that. I am very, very open-minded. I look at everything.
Same.
And I try to be very mindful, and I'm working on self-awareness, where I can see something that I don't agree with, but still know how I can work around that.
Yeah.
Because you live in a society now where you have no choice.
Yeah,
People will put whatever they want there. So the way you feed and train your mind is very important. You have your things that you think are the right way, and you look at other things and you think, oh, maybe it's not, but why? Because there's a reason why people put what they put out there.
Exactly.
But training your mind, being more mindful on how you can see these things and still, be able to walk around it. That's very important.
And even understand whenever you see those things, how they make you feel.
How they make you feel.
So when you look at something and you feel yourself looking towards that as a negative thing, sometimes it's just great to just remove it.
It's not. Yeah.
Just remove it from your timeline.
Yeah.
Or if you're hanging around friends or family and you feel negative feelings or negative thoughts, I think it's important to remove yourself.
100%.
Or even have a conversation with that person.
Yeah.
To let them know this is how you feel, and is it something that they can do to make it better, or is it some sort of relationship that you've had for years?
Yeah.
So I think definitely being mindful on how you feel whenever you interact with certain things in life is important.
100%. How you feed your mind. So mind, body, and soul. How you feed your mind, body wise. Are you exercising? Instead of sitting there and be like, oh, I don't have this, I don't have this. Are you exercising? Are you confident enough? Do you love yourself? Because if you love yourself, you're going out there with your best self.
Yeah.
Loving yourself is different for everybody.
It is.
What's one thing you do for yourself that makes you feel good and better? Especially for young people, you're looking at social media, you're seeing things, you want this, you want that, you want to be that person. Can you sit down and reflect on who were you when you were that little girl, when you were growing up? What did you want at that time?
Yeah.
These days we don't have that. These days we're forgetting all our creativities. Who we were when we were younger, now we're looking at social media. That's what I want, and you're losing yourself, you know. And your soul is just basically everyone that you get involved with. Like, so I do mindfulness exercise a lot. Mindfulness for me is basically, I try to be self-aware of situations, you know. I wasn't always like that when I was younger. Quickly I'll get annoyed or angry or pissed off about things. But I'm so grateful to where I am now, because mindfulness to me is, no matter how chaotic a situation is, I'm able to step back and look at it from other people's point of view. See, mindfulness for me is basically just helps me if I'm in a chaotic situation and being able to just reflect, bring myself back to the present moment. So I'm not just overreacting. Just put into consideration that there's a reason why people act how they act. You're not a little bitch, because people think, oh my God, it's just that you're just way mindful to get involved in that, you know? And it's like the people around you. So your soul you need to feed your soul with the
Right people.
Right people. And the one thing also that I don't agree with personally is that people tend to filter the people you hang out with or who you pick and choose. I talk to everybody.
Yeah.
That's how you learn and grow. I'm protecting my peace, but I'm still learning from other people. And I know how I became this person because of what I do for work. I've learned how not to pick and choose, because you don't know people's story. You don't
even have the choice whenever
you don't have the choice.
When you're working as a clinician, whoever is your patient is your patient that day.
And it comes with friendship. Like if you see someone, you start judging them from distance, you don't know them. Like obviously, yes, set boundaries with people. I risk assess people, because I don't just go out and talk to everyone. Like I risk assess, but I'm not someone that's just like, yes, my soul is at peace. How would you learn and grow?
Exactly.
You know, every day is a new day to learn and grow. Like every day. And that's why I love life. Like every day is a new day to start over. You know, and there are people that can't do what you're doing. So are you going to sit there and be like, oh my God, I don't want to do that. I want to go out there and do more. And I'm getting to know myself in the process, and I'm learning and growing and making mistakes. That's the best thing I've ever done in life, making mistakes. And that's one thing that I feel like most young people should learn. Like you don't have to be perfect.
Mistakes are where you learn and where you grow.
You don't have to be perfect.
Yeah.
Like you don't have to. I was by myself for a long time. And that's the best thing I've done. I'm not encouraging people to move out, leave your parents or whatever. I'm saying that when you teach yourself how to just be open-minded and learn from every single person, it stops this division and not just listening from the naysayers. You're learning it from yourself. And that changed my life. Because I go out every day being who I am authentically. Because I'm like, people are different. Unapologetically. Yeah. Just me. Take it or leave it. My intention is definitely not bad. That's all you can control, your intentions. Like, you're going out there with a good intention. So whatever people think, let them be, you know. Who cares?
I love that.
Yeah.
And let's go on to, I guess, touch quickly on, I guess, social media. Mm-hmm. Mental health and how social media has, I guess, a positive and negative effect on people's, I guess, mental health. What has been your experience, or what's your opinion on social media when it comes to that kind of thing?
Oh God,
because there's good and bad in everything in the world.
There's good and bad in everything.
Just how you use it, I guess.
Yeah. Well, back in the days, long time ago, you only had competition with your tribe, your country. But now you have the world stage of
give
everyone, you know. So the positive thing about social media is that it's informative. There's so many informations out there. It's helpful. And, if you need something, you can just type on social media. It makes me laugh. I love the funny TikToks, you know. Yeah. The good thing is you can also filter what you want to see. And, that's a good thing, Yeah. It's very good to be. And people are so creative. It's so creative. It's just that the cons, the other thing that I see about it, the other side, the negative side, is that people need to look at, for example, your own creativity. Just because someone it's not creative has done this doesn't mean your idea is like not good enough, you know? Like, I feel like social media should motivate you in a right way, not like, oh, because this person has done it, like, I don't know if this is making sense, but because someone has put something out there, or I want the same thing.
Yeah, you kind of comparing
You're
yourself.
comparing
Comparison
yourself.
is a thief of joy.
Comparison is like a lot of comparison going on, because before you just had a little community or your friends, but now you're like a little ant in a whole planet. Just remember that. Like this, even if one person doesn't love your idea, like the next person will. Like, you don't know what you're putting out there, and you don't know people relate to you. If you don't put your own authentic self out there, how would you know if people do relate to you?
And I also think people need to remember that social media in general is a highlight reel. People have a full life that they're out there living, but you only get to see up to 90 seconds worth of video per post that they allow, and you only get to see one photo or 10 photos in a carousel that they post, or whether it's on TikTok, whatever. You only see a small snippet of their life, no matter what platform that you're looking at them on. So I think as soon as you really understand that, the quicker you'll realize that even if someone's life does seem amazing, which it probably is, a lot of the times there's also other things that they're maybe dealing with that they're probably not comfortable showing on social media as well.
And when I talk about these things, I kind of try to remove my profession in it, because if I put mental health in, I'll be like, oh my god, what are you doing? So I'm trying to, like, okay, no mental health.
Look at it from just a normal person.
Normal, just like general, like, you know, because I don't take nothing for granted.
No.
You know, like, I don't, because I go on social media, I see someone doing good, I'm like, oh my god, like, wow, that person is doing great. I'm not saying that sometimes it doesn't affect me, because, like, I used to do modeling, a lot of modeling, okay? And then now that I'm just doing nursing, because I'm someone that I do a bit of everything.
Yeah.
I'm doing nursing. Sometimes you're burnt out. Sometimes you're tired. And I might flick on social media and be like, oh, look at this model. I could have been doing that.
Yeah.
So it all comes back to, like, your self-awareness of why you are where you are today and the reasons. And just link it back to your story. It's so important to look at social media and be like, you see someone or something that you want or where you want to be, and link it back to your story. You know, like, you don't know that person's story. You don't know their head start. Not everyone has the same head start, you know. Link it back to who you are and your story, and how hard you fought to be
where you are today.
Yeah, where you are today. Like, you can't just see something like, I want that. And I have to do that a lot. Like, that self-awareness has helped me to be who I am today, and I'm still learning that. It's okay to go on and be like, I want that. It's being a human being. We all do it. But it's like, how do you come back from that?
Yeah.
How do you, like, just work around and be like, okay, and it's helpful, and it's just like pushing forward, but in your own way, like your own way,
one step at a time.
It's all about you, like, because if you're working on you and you're just putting yourself out there, going back to your story, it's the best way, I think, best way forward for me, by my experience. And yeah, so I guess
speaking from going forward, that brings us on to our next point. What are kind of your hopes for the future, whether that's within mental health, but also, I guess, within the nursing and clinician side of things as well?
Like, for my future or in general?
Well, yours, and then also, I guess, general.
Yeah. So I feel like for the future, it's just looking at our, like, the generation, what we're going through at the moment, like, looking at things, I just want more mental health nurses.
You think there's a lack? There's a lack of that?
There's a lack because of the stigma.
Yeah.
So I will, like, we really need more mental health clinicians, mental health nurses, and just come in, have a look, and learn for yourself and see, like, you know. And we are burnt out. It's been very busy and very hectic.
Yeah.
You know, in our area and the field we're working in. You know, especially with the long-term COVID effect, it's still going. It's ongoing. It hasn't stopped.
Yeah.
And so my hope in the future would be, like, if people can just join and just work with us and just still continue creating this awareness, you know, to just kill the stigma, because the same way we look after our physical health, it's the same way we need to look after our mental health, because everything connects, you know. Yeah, that's my hope for the future.
Awesome.
Yeah.
And then just to finish off, obviously we're a recruitment company and people are going through their own career paths, but do you have 3 tips for someone who's wanting to become a registered nurse and maybe even more specific, go into that mental health pathway?
Yeah, tip number 1 for so as a registered nurse, okay, nursing is a very broad industry. I'm sure everyone knows that.
Yeah.
So for me to discover what I wanted, like, it hit me. Like, it was just what I do. I'm very passionate about it, and it was so natural to me. So if you want to be a mental health nurse or a clinician in the mental health field, you need to be able to, it's something that you want to do. It's something that you're passionate about, because it's not something that you just want to do for the sake of, you know, it's not something like that, because you're dealing with people going through all these emotions. People are always unwell, and you're dealing with that every day.
Yeah.
Like, are you looking after your mental health? So tip number 1, make sure that's something you actually want. Number 2, make sure, what I see is just look after your mental health first. You come first. You can't pour from an empty glass.
Yeah.
And 3, we just need nurses. You know, we just need some clinicians to join us and just kill this stigma. And we're just, every day we're working towards, look at the world where we are right now. We need support. Everyone needs support. Like, you know, like, don't be afraid to join the team. And yeah, you need to come and join us. And I guess I don't know what to say. I feel like I'm promoting people to come and listen. Yeah, I guess that's what I would say. And yeah.
Awesome. Well, thank you very, very much for sitting down with us today. That was a great conversation, very informative, very emotional.
Yeah.
But again, one of these things that needs to be talked about on the regular, and I guess there is this place in society now where people think, oh, the mental health thing is getting drawn out, or people are talking about it too much. But I don't, in my opinion anyway, I don't think it's talked about enough. Especially within a society where people are committing suicide on the regular. If that's something that is constantly happening, then there can't be enough conversation being done. So thank you very much for spreading some more awareness with us today.
Yeah. And just to finish up, guys, sorry, just need to put on so most of the things that I usually get, people usually tell me, oh, I don't know where to start. Where do I get help and how to get these helps?
Yes.
So I guess just like everything in life, if you're not willing to do it, how you're going to get the help? You have to be willing to actually get involved and do it.
Exactly.
So some of the tips, like some of the areas that places can get help from, like the services, for example, the first step I tell people, basically go to your GP, ask your GP for a mental health care plan. You can start from there. You get 10 sessions. You go for free, and you see a psychologist. You tell them how you feel, you know, and then sometimes they will listen to you based on what you're coming in with. They can just do further referrals, or like, you know, just things that will help you and your situations, because there's numbers of therapies out there. People are always saying, get a therapy. It's not about just getting a therapy, it's about the type of therapy
that you need.
And the best way to go with that, go to your GP, get a mental health care plan. And there's also, like, my hospital also has this area, safe havens. Safe havens is just a non-clinical base. You go in, you have like peer workers, like there's food. You just go in and you just sit down.
This is St. Vincent's
St.
Hospital.
Vincent's Hospital. So you just have a sit, you have a chat with someone, talk to them about what you're going through. You just go in and you have peer support workers that will help you, that have been through similar situations, and they're here to just help you go through it. That's non-clinical. You just go there and just have some food, do some art drawing, just this fun stuff, you know.
Yeah.
And This Way Up is another thing. This Way Up is like an online platform where you go on. You basically have, like, they have everything there. Like, you know, you type in what you're going through. Basically, like, you go on and then you just tell them, this is what I'm going through. You have like psychologists, you have like psychiatrists, everything online.
Amazing.
They get to talk to you and then just lead you to the right pathway. Anxiety, everything. Anxiety, like depression, they have all these online things. If you don't feel comfortable to go in and speak to someone, that's another way you can go through. We know about Headspace for young people.
We'll definitely link all these in the description for people can click.
And the mental health hotline is 1-800-011, 511. I know it by heart.
She knows by
You
heart.
just call them and you're like, look, this is what I'm going through. And they get to chat to you, book
Yeah.
you an appointment for you to come and see them.
Awesome.
So, and it's so confidential, just to let you know, very confidential. You go in and you talk to them, and that's what they train for, to help you. So, yeah.
Perfect. Thank you very much.
Thank you.